All right, guys, it's no surprise that every pharmacy student has the goal of passing the NAPLEX. But what separates those who do from those who don't? It's not luck, it's about being prepared. Hey guys, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from the what to the why. The why here is centered around those factors that have been shown to be predictors of success for first-time test takers of the NAPLEX. Now, before we jump into that, if you have not seen my topic review on why the NAPLEX scores have declined over the past decade, or what type of content is actually being tested on the NAPLEX, that is worth watching along with this. My goal is that you'll walk away with a clear picture of how to measure your readiness and what to change now to maximize your chances of passing on the first attempt. Recognizing some of these is not meant to be definitive for all of you. However, these predictive factors that we're going to talk about briefly have been discussed or found in the literature to be predictive of success. In fact, they explain approximately 50 to 70% of the variance of what the NAPLEX outcome is going to be. Even better, several of these are actually up to you. Now, the first and probably most obvious predictor is the GPA, looking at your cumulative, but also those pre-API. Higher GPAs greater than 3 correlate with a 10 to 20% higher pass rate. Those of you with no D's or F's in your grades in pre-pharmacy, okay, and your prerequisite courses also has been shown to double the odds of passing. Again, that just shows, again, the continuity, how serious of a student, your ability to take tests. That doesn't mean that if you failed or struggled early on that you can't overcome that, right? We've all been there. But it's still something that should guide you, your own assessment. Next is thinking about pre-admission metrics. Things like the composite GPA we just talked about and PCAT scores. While PCAT is no longer required of schools, it's still part of the literature of predictors, right? And those, it's a moderate predictor for your ability to have higher pass rates, right? But unfortunately or fortunately, depending on how you want to look at it, the PCAT, like I said, is no longer used in any school for admission. What about PCOA? Also a tool that has been around for a while but is no longer required by the NABP of schools, right? Some schools still have annual exams, so it kind of correlates a little bit with that. And then your pre-API GPA. So PCOA and pre-API GPA. Well, PCOA scores have done some support for prediction of their performance. That's why schools use those annual assessments. Explain maybe 25% of the variance in the NAPLEX scores, okay? What about your clinical performance? Strong IPPEs and APPEs, right? So those grades and skills labs help predict higher scores and are thought to be reflective of the student's ability to apply knowledge, right? Which is what a test question is supposed to be assessing for. What about the timing of when you take the NAPLEX? It actually does matter. If you take it within 60 days of graduation, those who self-reported, that they had a pretty moderate to high study effort, right? They poured into it. Increase those chances of passing by 2 to 3-fold. Now, that's something you can influence. Before you graduate, you come up with a plan, you implement the plan, and you stay disciplined to do it and take that test. Why would that time frame be relevant? Well, think about what you've been doing for 3 to 4 years. You've been taking test after test after test, forced into thinking and reading and studying. Your mind is conditioned for it. Kind of like preparing for a marathon or a triathlon. You have that condition for it. Your mind is sharper. things are more on the forefront of your mind. Remember, the exam is only testing what a competent level, entry-level pharmacist should know. All right, what about your pharmacy school factors? Well, again, not to discourage anybody, not to talk negative about any program. That's not what this is about. But depending on where you went and the academic environment, it does seem to correlate. So those in public programs that have been accredited pre-2000, okay, so that means they've been around for a while, okay, and located within academic medical centers seems to be predictive or correlate to higher pass rates. Schools who are four-year programs versus three-year programs. The four-year programs tend to perform better. Programs that have higher matching to residency programs. Now, why is that? Well, I mean, think about it. There's some pressure. When you graduate from pharmacy school, most people have about a month to month and a half, maybe close to 2 months off before they start residency. Well, that's that 30 to 60 day bubble. And you don't want to go into residency and not pass, like show up at residency and you've failed a basic competency exam, right? So there's a peer pressure, internal pressure there. It also can set back your career and delay starting. I mean, I did a pharmacy residency after I graduated. I can tell you, I was motivated. I did not want to be the one resident in my class who failed the NAPLEX, right? Okay, so that's interesting, but what do I do about some of these things? Well, first, which you may be asking yourself, like, what do I do? Well, assess and build your own predictors. Look at some of those predictors and apply them to yourself. Review your own GPA. Where do you stand? Pre-pharmacy, pharmacy, your science, non-science. Okay, that's going to tell you, again, that predictor of success. Take practice NAPLEX exams early. Get into the mentality of taking that test where you're answering multiple choice questions over and over and over again in a variety of topics. Okay? And if your scores are low, then remediate or do something that's a targeted review. Go to some established resources, especially resources that give you access to practice exams or test questions that are teaching you core concepts. Why? Because you're being expected to answer questions. That's what you need to practice. And if you're answering those questions, you have access to a Q bank or practice test bank, your cumulative performance should be, okay, over 85%. If you're significantly less than that, you're definitely in the 70s, there's concern there. You need to then recognize or find a tool that will allow you to identify your strengths and weaknesses. And in fact, that's one of the reasons why I started High Yield Med Reviews. If the resource you're doing is encouraging to memorize or all you're doing is reading a book, that book is not working because if you've looked at the pass rates, they keep going down. Consider joining a study group. Why? Well, that helps with motivation and also creates some degree of accountability. But whatever you do, don't just keep studying the things that you feel comfortable with. Address your weaknesses. Guys, I hope that you found this topic to be helpful. I'm Dr. Busti, and this is why we're here. We're here to invest in each other, okay? By helping us to understand why we do what we do so that we can master the how. And the how here is how to study and use the predictors that are known of people who succeed, right, to our benefit. And where can you then modulate or pivot your strategy to maximize the success on that first attempt? And I believe you can do it. All right, I'll see you next time.